Oncology, parameters not met or change of treatment plan workflow. With this workflow, there are many decision points to capture all the variances that can happen in these instances. Generally, this workflow would start with a patient's parameter, lab, diagnostic, or potentially assessment of the patient not meeting the criteria to proceed with the treatment planned. In this example, let's say the nurse has called the doctor while the patient is present for treatment of their next cycle, as a parameter has not been met and they need to verify with the physician. The first question is, does the patient need a provider assessment? If they did, we would follow the provider assessment patient workflow. Following this, we would ask, does the patient require any further investigations today? Let's say the provider wanted to order creatinine clearance on this patient for further investigations prior to deciding about treatment moving forward. The provider would access the patient's chart and they would, under their provider view, access the quick orders page. Within this view, they would select the corresponding lab that they would want to order, for instance, the creatinine level. From here, they would go into the shopping cart and click Modify to ensure the details are correct for their ordering purposes. They would leave it in a future status so the lab or nurse collecting could act upon this order. Once they were satisfied with the details, they would click to sign the order, and the lab would be drawn, and then they could follow up with the result to see if treatment were to continue today. At this point, let's say the treatment is not going to continue today. The first question would be, does patient need admission? If they did, the oncologist would follow the direct admit from clinic workflow. The next question is, does the day of treatment need rescheduling? If so, they would follow the oncology rescheduling request workflow, which has been done in another video. Now, likely, if they are rescheduling the chemotherapy, the next question would tie in, do the labs need to be reordered? If they do, the oncologist would follow the oncology reordering labs workflow, which is also shown in a video. The next question following this is, does the patient require any prescription? Some prescriptions that may be added would be Neupogen or pain medication to help to support treatment. They could access their orders tab, which we are currently under, and ensure they are under the outpatient prescription view. From this venue tab, they would select that view. When under this view, let's say the oncologist wanted to add magic mouthwash for the patient. They would select the correct corresponding prescription they are wanting to order, click into their shopping cart, and select Modify. From here, they would ensure all the details that are required are filled in. This blue circle with an X icon is telling me that there is one missing detail required. If I click on the order, the yellow field here is the missing required detail. As the oncologist, I would simply complete this field for the stop date of this medication and sign the order. This would be given to the patient per the local facility's procedures with printing of prescriptions. Now, if we take a look at the other route, is treatment going to continue today? Yes. Now, is treatment going to continue unmodified? Let's look at the option if treatment was going to continue unmodified. If the patient's ANC was below the parameters for their protocol and the provider still wanted to proceed without any change, they would go to the patient's order profile. So from the table of contents in the menu, I would select orders and I would want to view the chemotherapy phase for that day that they were considering to continue treatment for. Under the chemotherapy phase, I would select the icon for View Excluded Components. When they select this icon, two options appear at the top of the treatment plan. They are built into all systemic power plans. one to proceed with treatment based on blood work from, and the other okay to proceed with treatment. In this instance, the provider would select okay to proceed with treatment. The provider is now required to fill in the details. In this example, the provider could type that they are aware of the low ANC of 0.9, proceed with treatment as ordered. Now the provider would sign this order and refresh their screen. The order now appears as a part of the chemotherapy phase, and both nursing and pharmacy could see this order and continue with their workflows. Nursing would continue with the verification and administration workflow of chemotherapy, and pharmacy would continue with their pre-chemotherapy checks workflow and their medication verification dispensing workflow. Alternatively, either nursing or pharmacy could take this order if the provider was unable to enter it themselves. They would have to place the order in the same fashion, but put it as a telephone order with the provider's name. This order would land in the provider's message center to accept at a later time. However, this would not hold up any processes moving forward for that time being. Now, if we go back to the decision point, is treatment going to continue unmodified? Let's look at the option if treatment is not going to continue unmodified. The first question is, do the chemo orders require modification? At this point, if the provider wanted to dose reduce any chemo being given that day, they would come to the chemotherapy phase of the power plan and scroll down to the treatment regimen section. From here, they would choose which medication it was they were wanting to modify. It could be one or all. In this instance, let's say that we're going to modify the oxaliplatin dose. The provider would right-click on the order, select to modify, and click on the treatment calendar icon. From here, the provider could see the targeted dose in milligrams per meter squared, as well as the final dose that was intended to be given today. Taking into consideration the low ANC from our scenario, the provider may choose to dose reduce to 80%, simply clicking down on the arrow beside the percentage. Once they select to dose reduce, the provider is required to give a reason for the adjustment. In this scenario, we would select due to neutropenia. However, if there was nothing on this list that pertained to the reasoning of the dose reduction, the provider could enter a note of why they were doing the decrease in this free text box here. They would then apply the dose. Now back on the chemotherapy phase view, the provider can see that there was a 20% reduction due to neutropenia. Once satisfied with the changes, the provider can move forward, signing the order. Now on the nursing and pharmacy side, this dose reduction would be shown in this chemotherapy phase, along with the reasoning the provider is giving for the adjustment. The next question is, does the patient require any additional supportive treatment? For example, creatinine clearance was off and patient needs additional hydration within their plan. The provider has two options. They could access their quick orders, so go back to the provider view and under orders, making sure that we're under the correct view. So in this instance, we would want outpatient orders. The provider would select whichever order they would want to add for that day. For instance, if they wanted to add a bolus of saline, they would select from here, go to their shopping cart, and modify the order to ensure the details are correct. Once they saw that the order details were correct for this patient and today, they could sign this order. If they knew they wanted something to continue throughout the patient's treatment trajectory, they could add to phase of the chemotherapy plan. For example, maybe they want the patient to have extra anti-nausea medication before each treatment in the future as well. The provider would go to their orders profile, and under the chemotherapy phase for that treatment, they would select Add to Phase and Add Order. For here, we would type in whichever order the provider was wanting to give to the patient prior to treatment. And if it was a multi-day plan, you would select which days you wanted to add this medication to. And from here, they would sign the orders once complete. Now for this order here, we added prochlorperazine. And one thing to note is when added to phase, the order drops to the bottom of the treatment phase plan. Now the last question within this workflow is if there is a complete protocol or regimen change. Potentially the patient had a severe reaction not allowing them to proceed on the same treatment, or maybe pathology reports show disease progression. If this were the case, the provider would discontinue the actual regimen when looking under the View tool. The regimen lives at the very top. So for here we can see that below it we have cycle 1 and cycle 2, which are power plans within the regimen. If the regimen was to be discontinued, the provider would right-click and select Discontinue. This would require a reason. So for instance, patient showing progression on treatment. The provider would sign for these orders to discontinue the regimen. At this point, if they knew what alternative treatment they were wanting to start, they could follow the chemo order entry for adult workflow. It is important that if the provider wanted to keep the patient's scheduled spot for treatment, they would need to communicate with the appropriate clinical and clerical staff, as once a regimen is discontinued, any associated scheduling orders with it would also be discontinued. Therefore, if they knew the treatment they wanted to start the patient on, they would speak with the nursing manager to ensure the current slot allowed the correct time, as well as with the scheduling clerk to arrange these details. The communication of changes also flows down to the pharmacy profile manager, as well as communicated to the nurse and pharmacist via the phone conversation, which is not replaced with the system implementation. If the patient was not to continue with treatment, this would be communicated by the nurse, and the patient would be contacted by the scheduling clerk once any rebooking was done. This concludes the oncology parameters not met or change of treatment plan workflow.